pitted the top two players from the Western Division against those of the Eastern. The Western Division team won the game 8-6 with 5 home. Has always played first base. Harrison, who has never played for the Eagles, hit his homer in the bottom of the 6th inning. Dr. Stan says there's a floozy, and I'm not going to see this a patient anymore. That's not there. The 5 home run hitters were Lawson, the Coyotes player, the Eagles player who wasn't successful, the third baseman, and the one who hit his home run in the 8th inning. Has its own colorful name. Using all the clues that follow, match each kayaker to the rapids he or she ran, and determine the class of each rapid and the state in which it was found. Puddle Fork or Rushing Eagle. The Class 3 rapids were in Colorado. The Class 4 rapids, Diamond Kayak, last week weren't in Arizona. The Class 2 rapids weren't in Utah. Ethan has never been to Arizona. Bella just came back on her kayaking trip to Vermont. 5 battles took place between May 4th and June 9th, 1553, each led by a different Beresford. Using only the clues that follow, match each battle to its date and determine who led each of the uprisings and with how many soldiers.
Sounds good. Let me look at your eyes now before this goes away. Oh, that's
we good?
Better. Yeah. All right. Let me take a quick picture, okay?
Speech got worse, then it got better.
Yeah.
How much Pfizer did you give him?
1 milligram. All right.
Yeah.
So now look up again and keep looking up.
Oh, that one hurts.
Then we'll take a picture. And keep looking up.
So you said last time about a few minutes into it, his lids would lag.
Yeah.
And his heart rate now is down into the 60s. Well, so it really hasn't changed much. It actually went up with him talking, I guess.
So how did he present to the ED then? He basically...
So he had some kind of episode where he said he was bending over to pick something up. He felt weak, and then at the same time he got very dysarthric, and then immediately afterwards he experienced dysphagia, was unable to eat a meal that he was trying to consume, and then...
So he came in as a cold stroke then?
Yes, they did run a stroke code. He came in, they ran a stroke code, CTA was negative, and then
the myasthenia gravis was diagnosed.
Neurology was consulted, and they said, hey, we think this is myasthenia gravis. So they gave him a neostigmine trial, and he perked up and thought
fairly
it was
dramatic change.
The greatest thing in the world, and he wanted to be sent home on that.
So both of you guys are actually going to go into emergency medicine, is that right? Okay, good enough. So let's talk about myasthenia gravis. What is myasthenia gravis?
So essentially, myasthenia gravis is an autoimmune disease that affects the post-synaptic membrane of the neuromuscular junction. And these antibodies competitively inhibit acetylcholine, and so the result of that is failure of muscle contraction with prolonged use or repeated use.
How do they normally present?
So patients with myasthenia gravis typically will present with facial and neck weakness as well as proximal limb weakness. The symptoms they might be having are ptosis and diplopia, and the symptoms tend to get worse after prolonged muscle contraction, as Carly said, and so sometimes they'll tell you that they feel worse later in the day.
Okay. So what populations are most affected by myasthenia gravis, and how common is it?
So this is a fairly rare disease. There's only about 3 per million annual cases in the U.S. diagnosed, and it's pretty well documented that there's a bimodal distribution. We see people in their 20s to 30s, predominantly females affected, and then the second age group is males predominantly between 60 and 70 years old.
Okay, all right. And if you suspect myasthenia gravis, what kind of workup should you do?
So after you have ruled out the life-threatening things such as stroke, you would want to do an EMG. You would want to perform antibody studies to see if you have acetylcholine receptor antibodies. And you can also do trials with acetylcholine esterase inhibitors to see if their symptoms improve.
What types of emergencies do you need to be aware of for patients with myasthenia gravis?
So for myasthenia gravis patients, the two big things you're concerned about is myasthenic crisis, and that's basically when the respiratory muscles become involved, and these patients can present with tachypnea, shallow breathing, increased secretions where you'll hear rales, wheezing, crackles bilaterally because they're not able to get their respiratory secretions up. And we become very concerned about those patients, and they usually require rapid intubation as well as treatment with either plasmapheresis or IVIG that is designed to attack the antibodies. So either of those are useful to help clear the autoantibodies from your system, but these patients do need to be intubated. Another serious condition that you have to be aware of is cholinergic toxicity, and
It's from their medications.
it's from over treatment with the medication. So it can look like myasthenia, but you'll also have sludge symptoms. So that's going to be your salivation, lacrimation, urination, defecation, and emesis. So, and that is treated with atropine.
Okay, good. Hey, what year are you guys in medical school?
We're finishing up our third year of medical school
Third
right
year.
now.
Okay. All right. So next year is when you start applying.
Yep.
That's correct.
All right. Good. Thanks.